Hey everybody, Dr. Scott Keller coming at you from Synergy Chiropractic today in my office, and today we're going to start into some core stability work. We've been preaching this kind of with most things, whether you're stretching, doing stability exercises to keep your ribs down, to keep your core tight, through all movements, okay? We've talked a lot about posture from a side view, anteriorly tilted pelvis, an increased curve in our low back, and kind of this flared rib appearance is the posture that's going to cause a lot of problems up and down the entire chain. So it's hard for some people to maintain this position in their core while going through a movement, such as a squat, or especially with overhead lifts where we all want to flare our ribs and hyperextend our back. Okay, so what we're going to work on today is a pretty simple exercise, but it's going to be really challenging for a lot of people. It's kind of going to be a funny thing to a lot of people. We're going to talk about how we breathe today. How do we properly use our diaphragm to create proper core stability, okay? And this is basically a foundational, fundamental thing that you need to train your body how to do in order to be able to brace and have proper stability and strength to protect your back, your hips, and then up and down the chain. Okay, so the first example, a couple examples. If you guys have kids or have little kids that you're around, anywhere from toddlers, newborns up through toddler age, if you watch them breathe, it's really fascinating because most of them have these, little pot bellies, and when they breathe in, when they inhale, you see their bellies expanding in all directions, okay? That's actually neurologically perfect breathing patterns. They know how to use their diaphragm to expand through the belly instead of breathing in through the chest like a lot of us do. We call that paradoxical breathing. So when you take an inhalation, if you feel like your chest wall and your ribs rise and your neck rises, your shoulders rise, okay, that leads to a lot of problems. Shoulder problems, neck problems, back problems. So that's, once again, it's called paradoxical breathing, and it's an improper way to breathe. Okay, so the second analogy that I have for you is a pop can. So if we look, and I'm going to show you a picture here in a second, but the top of a pop can would be our diaphragm, okay? The bottom of the pop can would be our pelvic floor muscles deep down in there, and then the sides of the can would obviously be our core muscles that wrap around. All of that needs to be in proper position for that can to be very stable. So if you have a can that's in proper form, the top and the bottom are in a horizontal or parallel to each other, okay? And then it's pressurized. It's super solid, and if you try to crush a can when it's pressurized, you just hardly can do it. Okay, so take the pressure outside of the can, and then take the top and the bottom, and indent one of the sides so they're not parallel anymore. How easy is it to crush that can? Okay, so that's the example I'm using with this posture right here. So we take the diaphragm and the pelvic floor, and now we open them up like this. We call that an open scissors appearance, or that lower cross syndrome we've talked about in the past. And now your spine is in a really compromised position, and you lose stability from your feet all the way up to your head, the whole body, okay? So let me show you a picture real quick. Bear with me. All right, so my awesome artwork here. On the left, we see good position. So right back here, you have the spine. This is the diaphragm and the pelvic floor muscles, okay? So when we inhale, air should come in. These arrows here, the diaphragm contracts in a downward position. So we should have basically our abdomen in all directions should feel like it's pushed outward here and even into our spine and then down into our pelvic floor muscles. And obviously this is just outside pressure on both sides. So what we're doing here is increasing intra-abdominal pressure, which is going to create absolute stability through our core and our spine, okay? So once again, you notice that these two lines here are parallel to each other. The second we break that position, bad, okay? So we have the pelvic floor, the diaphragm is in a bad position now because we have that rib cage flare, and these are unparalleled now. So now what happens is when we breathe, our diaphragm doesn't work properly. We have this paradoxical breathing through our chest, and it screws up all the intra-abdominal pressure throughout our abdomen, okay? So an example of this, when you're lifting, when you're 1 rep maxing, you see people take in those quick breaths and then really bear down and hold it. That's what we're doing over here. We're increasing intra-abdominal pressure. Now, if you're in the right position, obviously, it's ideal, okay? So what we're going to do, ideally at home, you're going to have your legs rested on something. So whether it's a ball, a chair, an ottoman, a couch, doesn't really matter. I want you in a triple flexion position. for purposes of at the gym, we're just going to do it from this position right here. So you're going to lay flat on the floor. All I want you to do here, this is going to be super easy for a lot of you, really hard for others, is as you inhale, I just want you to feel your belly moving, okay? So we inhale, and it should be all belly movement and not a lot of chest movement. So I hope you can see this, but I'm just going to kind of demonstrate here really quick. Okay, as I do that, my belly's moving up, but it's also moving out, and my back is pushing into the table right now, okay? So really my core as a cylinder is expanding in all directions as I inhale. The common air is going to be breathing through the chest. You know, all chest movement, ribs flare, we rise up through here, okay? If you're able to do that properly, the next progression is going to be to stabilize your core or get in that tight position, okay? So I should feel like my rib cage is down, okay? My shoulders are relaxed, and now I'm going to keep that tight, maintain that tightness, and then breathe in through my belly as I show here. Okay? All right, if you're unable to do that, you can kind of cue yourself a little bit too. What you can do is put your hands around, so your thumbs are on the side, your fingers are on the top of your belly. You can do this in the relaxed position or the tight position, okay? What you're feeling for is just kind of pushing into those muscles a little bit so you can feel, once again, your core pushing out into your fingers a little bit. So that can kind of just help you know if you're really doing this properly or not. All right, so the drill today, lay on your back, relax, knees bent, use your hands at the sides as a cue. Nice, easy inhalations, preferably through the nose. You're just going to expand that belly in and out, relaxed. Then you're going to try to get engaged, ribs down, same thing, hands at the sides, breathe in and out. Okay, guys, it's really important to practice this one. And once you nail this one down, there are progressions from here that are way more challenging. But this is definitely step one. So good luck with this. If you guys have any questions, let me know, Scott@synergylincoln.com.